Hey, future nurses! Welcome back to Good Nurse. Today, we're tackling a really important topic you'll see a lot in practice and definitely on the NCLEX: pressure ulcers. You might also hear them called bed sores or decubitus ulcers. So, what are they? Simply put, a pressure ulcer is localized damage to the skin and underlying soft tissue, usually over a bony prominence. Think heels, sacrum, hips, elbows. It happens because of intense or prolonged pressure or pressure combined with shear. Friction also plays a part, especially with those more superficial injuries. Think about it. If someone's lying in one position for too long, the pressure cuts off blood supply to that area. No blood means no oxygen and no nutrients, and that tissue starts to break down. That's why identifying who's at risk is so crucial. We're talking about patients with limited mobility, poor nutrition, incontinence because moisture makes skin more fragile, altered sensation like in diabetic neuropathy, and older adults whose skin is naturally thinner. The Braden scale is a common tool we use to assess this risk. Now let's get into staging. This is super important for the NCLEX. Stage 1. The skin is still intact, but you'll see an area of non-blanchable erythema. That means it's red, and when you press on it, it doesn't turn white. For patients with darker skin, it might look a bit different, maybe purplish or a different temperature or firmness than surrounding skin. Stage 2. This is partial thickness skin loss. You'll see a shallow, open ulcer with a red-pink wound bed, or it might look like an intact or ruptured serum-filled blister. No slough, that yellowish stringy stuff, or eschar, hard, black dead tissue, yet. Stage 3. Now we're into full-thickness skin loss. Subcutaneous fat might be visible, but bone, tendon, or muscle are not exposed. Slough might be present, but it doesn't obscure the depth of tissue loss. You might see undermining or tunneling here. Stage 4. This is full-thickness tissue loss with exposed bone, tendon, or muscle. Slough or eschar might be present and often includes undermining and tunneling. These are really serious. Unstageable. This means the full depth of the wound is obscured by slough and/or eschar in the wound bed. You can't actually tell how deep it is until that's removed. So if you see a wound covered in thick eschar, it's unstageable. Deep tissue injury, DTI. This is a bit different. It's a persistent, non-blanchable deep red, maroon, or purple discoloration, or it could be a blood-filled blister. The skin might be intact or not. It's caused by damage to underlying soft tissue from pressure or shear. These can deteriorate rapidly. Prevention is key, of course. Regular turning and repositioning every 2 hours is a classic. Good skin hygiene, managing moisture, ensuring adequate nutrition and hydration, and using pressure-relieving surfaces are all vital nursing interventions. All right, that's a quick rundown of pressure ulcers. Make sure to like and follow for more nursing lessons.